Good afternoon, everyone, and thank you for coming to Bridging the Gap Between Technology, Cybersecurity, and Healthcare. I want to thank you for coming today. We're not just here to talk at you, we're here to engage in a conversation. I understand that you are the experts in healthcare, and I respect that. My aim today is to merge your expertise with our knowledge of technology and cybersecurity to create a safer, more secure healthcare environment for all involved. Let's start by understanding our common grounds, what you deal with day to day, and the challenges you face. Then we'll explore some real life stories to put things into perspective. We're going to give you some actionable tools to take back with your practices. And lastly, we'll have an open forum of any questions and honest discussions. Your time is valuable, and we intend to make the most of it. I would like to have this as interactive as possible, so use the chat when you have answers, when you have questions, or if you're trying to find some answers. Um, that'd be great. So, healthcare providers are special and necessity field. The work you do is immeasurably important, and that comes with its own set of challenges, especially when it comes to protecting sensitive information. As we go through these points, feel free to share your own experiences or questions you might have. We're here to solve problems. Let's talk about the following: patient confidentiality. The nature of the work you do means you're dealing with extremely sensitive and personal data. A breach isn't just about numbers or records, it's about people's lives. Regulatory hurdles. We have to juggle so many rules and regulations from HIPAA to state specific guidelines, all which while ensuring patient care. It's a fine line to walk. Your teams are multidisciplinary, consisting of healthcare providers, social workers, and administrative staff. Staff training and training everyone to be on the same cybersecurity page is no small task. And let's not forget resource allocation. The focus is often on immediate patient care, meaning that cybersecurity can sometimes take a back seat. Finding the resources to safeguard your digital asset is crucial. Understanding these unique challenges is the first step in crafting a strategy that serves you, your team, and more importantly, your patients. So let's explore how we can make your facility safer without adding to your already full plate. Understanding your cybersecurity risks. So, just like routine health checks aim to find hidden issues before they become big problems, today we're going to explore how to spot these less obvious cybersecurity risks lurking in the corner of your facility. First, we'll talk about unauthorized access. Think of this as someone entering a restricted area without proper credentials or being somewhere they shouldn't, or very simply, just seeing something they don't have the right to see. Could someone access your digital records or systems without you knowing? How about we'll talk about outdated systems. Think of it this way: you shouldn't use expired medication, right? We wouldn't do that. You know that as healthcare professionals. So why would you use outdated technology? I find this the hardest to explain when we go into facilities and they have computers that are older than 7 years old, and they've got networking equipment even older than that. Explaining, while yes, it's still working and running, albeit it's probably a bit slower than the newer computers, the fact that the manufacturer stopped supporting the equipment is very dangerous. Outdated systems are easier targets for cyber attacks. How about the human element? The old saying, to err is human and to forgive is divine. We know accidents do happen. Maybe somebody clicks on an email they shouldn't have, deleted a file or a record, exposed information. It happens, exposing information. It happens. And without proper controls in place, the forgiveness can be a little tough. It's like accidentally skipping a hand wash. Small actions can have and do have big consequences. Let's talk a little bit about third-party risk. You rely on suppliers and vendors just like you rely on referrals from other healthcare providers. Whether you realize it or not, we live in a supply chain society. I talk about this often. As businesses, we are most definitely in someone's supply chain to provide a service or care to their customers, just as other businesses are in your supply chain to provide the same type of services or care to your customers. But are those needs to be in your are those you need to be in your supply chain as concerned with your cybersecurity and their cyber hygiene as you are? Are you? Recognizing these risks is like acknowledging symptoms in an early diagnosis. Now, how do we treat them effectively without disrupting your main mission of patient care? Before we move on, are there any hidden I want you to type in the chat, are there any hidden risks you've encountered in your work that you'd like to share, or is there something that you'd like to learn about before we move on? I'm going to pause here, take a look at the chat. Okay, we're good so far. Nobody has any questions. Okay, so the number one question I always get when I talk about this stuff is how does it happen? So I came up with this breach timeline. So let's talk about something we all understand well, a front door. But it's not just any front door. Imagine you've just installed a brand new door to keep your home safe. But unbeknownst to you, this door has a flaw in it. If you jiggle the handle 3 times, the door pops open. It doesn't matter if it's locked. Good news, the manufacturer knows about this and has released the fix. The catch, you have to reach out to get to them to get the fix. But here is the kicker. The criminals are already aware of this flaw and they have a list of everyone who's just recently bought the store. So they take the list, they come to your neighborhood. Once there, they park in front of your house. And at the most opportune time, they come up to your front door, they jiggle your handle 3 times. Poof, lo and behold, the door pops open, right? They quickly close the door and walk away. Now, why do they do that? Well, it's very simple. They don't want to get caught, right? So they need to understand a little bit more about your neighborhood, your patterns, and they need time to come in and take a look around. At this point, they only know they can get in. They have no idea if you have anything of value to them, but they need to make sure that they can get in and out without getting caught, right? So they sit in front of your house, outside your house. So at this point, if they get caught, they'll probably just be shooed away, right? No, nothing they've done so far, right? So for the next few weeks, possibly months, again, they want to do their due diligence because they don't want to get caught. Here's what they've learned about your neighborhood and you. So your neighborhood, there's no neighborhood watch, right? Neighbors aren't looking out for each other. Hell, they're not even friendly with each other much, right? It's a very busy neighborhood. Lots going on, a lot of transient stuff happening. Between the by 9 a.m. till approximately about 5 p.m., no one is at your house. Fridays, you religiously take your family out to dinner, and you're usually gone from 6 p.m. to 11 p.m. Maybe you go to the movies, maybe you do like an arcade or whatever, who knows? But you're gone until about 11 p.m. The houses are spaced out pretty nicely, so they're not right on top of each other. So chances of a neighbor hearing anything going on in your house is very slim. In addition to that, the left side of your house, there's a row of hedges that blocks your entire left side from your neighbor's view. So literally anything could be going on the left side of your house behind those hedges, and nobody can see it, right? So now they've got all the information. They feel very comfortable. And again, remember, they've been in front of your house for probably several weeks, right? And nobody's called the cops. So now they feel comfortable and they're ready to go probing. So Friday night comes, 6 p.m., you guys head out of the house. They wait till about, 7 p.m. or whatever, whenever dusk happens. They come up to your front door. They jiggle the handle 3 times. Boom, they're in. Now they have some time before you come home. So the first thing they do is they go to the left side of the house because they have no idea what's going on over there. So they just kind of want to see what's happening. So, maybe you have a dining room over there, or, a living room, or whatever, a family space or whatever. Um, and they find a bathroom on the left-hand side. So they go in the bathroom. It's a nice sized window. They unlock it and pop it open. Their intent is to use that window to basically gather all the things that they find and put out the window so that the hedges are blocking it. So when they're ready to move, they're just going to jet right out of that window. Um, so uh, what they do is finally they start looking around, right? They find your prized possessions. It could be your jewelry, it could be financial documents, maybe some banking information, maybe some investment papers you have. Could be sensitive health records if we're talking about healthcare, right? They take what they want. They gather it all through the window, right? In the bathroom. Remember the bathroom window, right? So they take everything they want. They throw it out the bathroom window behind the hedges. When they're ready, now they just quietly leave, right? Um, at this point, they've gotten away with your valuable items, and at this point, you're none the wiser, right? At least not until you realize something's missing. Oh, by the way, when they left, they lowered your bathroom window down just enough so you can't tell that it's open. After things are settled down, they may decide to come back and see if they can get back in through that window and steal the stuff that you just replaced. So the cycle is complete from initial exploration to final exfiltration. The bad guys took advantage of a vulnerability you weren't even aware of. And here's the point that I want to drive home: they weren't even looking for you at first. So they had no idea who James or John Smith was, who lived on, 123 Mulberry Street. They just had a list of names and addresses of people who had a vulnerable door. Then once they found that, your door was not fixed, then they started to probe you a little bit further. So that's essentially how it happens. And this is why it is crucial for each one of us to be proactive, to understand the vulnerabilities in our homes, in our lives, and especially in our working conditions, like healthcare, where the stakes can be someone's personal well being. Now, after hearing this, does it make more sense to you how cyber attacks happen and how you can be a victim, even if you believe you're not important enough? In the chat, comment how you think people in the house feel after this break-in. Do you think that they feel all warm and fuzzy, or do you think they feel a little scared and concerned? And then now bringing this back to healthcare, how do you think the patients would feel, or your future patients would feel, when a cyber attack or a break-in occurs? I'm going to take a pause here and take a look at the chat here to see if there's anything in there. Okay, so we're good so far. I hope this is making a little bit sense to you guys. So I'm not sure how many of you here are aware of this breach that occurred back on February 6th of this year. Here's what happened. The Lehigh Valley Physicians Group was a target of a cybersecurity attack by a Russian ransomware gang known as the Black Cat. The IT department of the Lehigh Valley Physicians Group discovered ransomware on a portion of the network which they had acquired back in 2021. They quickly launched an investigation to determine the scope of the incident. Then, when they realized it was bigger than they thought, they immediately contacted a cybersecurity remediation team to assist in the investigation, and they also had to involve law enforcement. They were able to confirm that personal identifiable information such as names, addresses, phone numbers, social security information, and personal health information such as medical record numbers, treatment and diagnosis information, CPT codes, and other health insurance information. And for some unlucky patients, clinical images of the patients during treatment were released as well. In the aftermath, they have determined where they can enhance their security and protection. But that's more like, you know, the horse leaving the barn type of situation, right? So this wasn't just a mere disruption, right? This was sensitive patient images that were published online by a ransomware gang. This underscores that the magnitude of what's at stake when we discuss cybersecurity in healthcare. It's human dignity and patient trust, right? As soon as the Lehigh Valley Network was aware of the incident, they did take systems offline and activated a response protocol, which is great. But the quick response minimized some of the risk, but the damage to the patient privacy is already irreversible, right? Preventive measures are equally critical. The attack led to lawsuits filed against Lehigh Valley Networks. Immediate action is crucial. The failure to protect sensitive patient data can have legal repercussions that last longer after the incident has been contained. They did make great effort to communicate with their patients, but keeping the patients informed, sorry, while keeping their patients informed is vital. The transparency after the fact cannot replace the trust that's lost when sensitive data is exposed. And here's my final point. This does serve as a reminder of the urgent need to prioritize patient data protection in all healthcare. Because when it comes to healthcare, every data point is a person, and every person deserves respect and protection. So, HIPAA compliance and security assessment. In today's digital age, providing top notch healthcare isn't just about bedside manners or medical expertise. It's all about safeguarding the very personal information our patients entrust in us. So let's dive into how HIPAA compliance and security assessments are not just legal necessities, but vital tools in maintaining the sacred trust. So why compliance matters, right? Compliance isn't just about following rules. It's about building a relationship of trust with your patients. When people know their data is safe with you, they're more likely to engage fully in their healthcare journey. Why should you even care? Well, noncompliance isn't just about penalties or fines, as that seems to be the higher level approach here, or getting caught, right? It can tarnish your reputation. Imagine being known as a ship that's prone to leaks. How likely would someone board that ship if they knew there was a chance of drowning? Routine checks, just like regular health checkups can catch symptoms before they become severe issues, routine security assessments help us spot vulnerabilities before they become a crisis. It's about being proactive rather than being reactive. And I know a lot of people ask me, what is the link between HIPAA and cybersecurity? And I know at first glance that healthcare laws and digital safety may seem like they're separate worlds, but they're more like close cousins. Understanding how HIPAA and cybersecurity intersect can empower us to create a safer, more secure environment for both the patients and the healthcare providers. Now, how would you feel if your organization was a victim of a cybercrime, like I explained in the breach timeline or the Lehigh Valley Network? How would that make you feel? All right. How do you think your patients or your future patients would feel? And finally, how do you think that would affect your bottom line? So October 31st, 2021, this practitioner of the North Carolina family practice was unable to log into their EHR system. They didn't think any big deal of it. They were just kind of in there really quickly just to do some things. The next day, Monday, the The staff came in and they also weren't able to log in. Soon after that, they got confirmation from their practices cloud provider. They have been targeted in a ransomware attack. That ransomware attack impacted dozens of organizations just like this family practice. The criminals were demanding $5.1 million from the provider in exchange for the decryption key. FBI and cybersecurity experts got involved quickly. Now, the cloud provider did have an action in place by noon of that day. I'm sorry, but the practice had no idea how long it would take. They actually just assumed it would be up and running, within a couple of days. Shortly, they realized they'd become collateral damage and had to figure out how to operate their practice without their practice manager or their EHR system. Imagine not being able to submit claims. What would you do? What do you think that would do to your cash flow? Now, they were fortunate to have a backup service which allowed them to do some paper charts and reports. So they were at least able to record their patient information. Would you be so lucky? Now, here's the thing. It didn't take a couple of days to resolve. It didn't take a couple of weeks. It took over 3 months to get their service returned. So here's some takeaways on this. It serves as a wake-up call for smaller healthcare providers who may believe that they are not a target for cyber criminals. No practice is too small to escape notice. This incident wasn't even a direct attack against them. It originated from a third party. And again, I'm going to bring it back to I'm always talking about supply chain attacks and cyber hygiene. Simply put, as a business, we rely on businesses above and below us to serve our clients, as much as other businesses rely on us to serve their clients. Stresses the importance of vetting your partners and your vendors. Are they as concerned about cybersecurity practices as you are? Are you concerned about your own cybersecurity practices as they are? Recovery takes time, resources, and can impact your practice's reputation in the long run. Financial burdens of an attack like this can be crippling for a small practice. They aren't just one-time costs. They're the start of ongoing investigations in robust cybersecurity measures, which become a priority now rather than an option. Regardless of the size of a healthcare provider, the need for comprehensive cybersecurity is universal. I hope the story of this independent practice serves as a catalyst for acting among all healthcare professionals to recognize the importance of proactive steps in cybersecurity. So, how exactly do we fit in this process, right? What can we do to protect your business? Our framework is simple and comes down to 4 things. But before I talk about those things, let me tell you a little bit about Underdog Cyber Defense. We focus on IT management and cybersecurity. We're really in tune with the healthcare industry, particularly when it comes to places like behavioral health clinics, drug and mental health rehabilitation centers. But don't worry, our expertise isn't just limited to those services. It stretches across all of healthcare. So why choose us, right? We saw that cybersecurity issues were becoming a big deal and realized a lot of businesses, especially smaller ones in the healthcare, weren't aware of the risks. So we shifted gears to focus on getting the word out and giving solid advice. First, we made sure we ourselves were HIPAA verified. That means we got an expert company on board to make sure we were following all the rules and regulations you need to worry about in healthcare. In other words, we kind of walked your walk. Next, we lined up our services with trusted cybersecurity standards to ensure we're giving you exactly what you need to stay safe. We talk the talk. And lastly, we didn't just stop at that. We're always learning, and teaming up with trusted partners is key to our success. To make sure that you're getting the best protection out there. So when it comes to defending your digital turf, we're the team that's done its homework to offer you real peace of mind. So back to our process. First thing we do is we protect people. Now, when we talk about protecting people, we're not just talking about firewalls or secure passwords. In fact, we're not really talking about technology equipment at all. We're talking about training your team, from nurses to administrative staff, so that everyone knows how to recognize and avoid risks like phishing emails or unauthorized access. After all, the most advanced security systems cannot stop a threat if someone holds the door open. What do we mean by protecting the process? So think of your hospital or your clinics or your rehab facilities operational procedures as the backbone of your cybersecurity efforts. These are your standard operating procedures for things like admitting new patients or accessing medical records. We help streamline and secure these processes. You make it much harder for unauthorized accesses to occur, safeguarding both your patients and your reputation. In conjunction with that, we help protect your technology, your equipment, your software are the gears that keep your system running. Ensuring that they're up to date and secure is like making sure a surgeon's instruments are sterilized. It's a non-negotiable item, right? From keeping software and hardware up to date to ensuring medical devices are secure. Protecting technology is about minimizing points of failure where security can be compromised. Even with cloud-based software, protecting technology is actually more complicated, not less. And then we go to safeguarding your data. Safeguarding patient data is crucial, and whether it's electronic health records or confidential consultation notes, this information is as private as it gets. Protecting it means not only complying with regulations like HIPAA, but going above and beyond to ensure that data is encrypted, securely stored, and only accessible to those who truly need it for patient care. So we've covered a lot of ground. So let's talk about how to move forward and build a secure environment for your healthcare facility. It starts with a 15-minute strategy session. Let's start with a focused conversation to understand your facility's specific challenges and needs. Then we'll schedule an assessment. Based on our initial talk, we'll set up a comprehensive evaluation to identify potential risks in your system. After that, we'll meet to discuss our findings. We always find that transparency is the key here. We'll have all your questions answered. And once we're aligned on the next steps, we'll create a personalized security plan for your facility. With that plan in place, we'll help you put into action, providing ongoing support along the way. Creating a secure healthcare facility is a reachable goal. Together, we can make it happen. If you're ready to take the first step, book a 15-minute strategy session by either going to underdog.contact or scanning this QR code. Any questions so far? Listen, I appreciate your time. I'm truly grateful that you came here. I know you're busy professionals, so I want to give you back your next 30 minutes. But I just want to end with security is a team effort, and your participation today is a step in the right direction. Again, if you're ready to take the next step in safeguarding your facility, don't forget to book your 15-minute strategy session by going to underdog.contact or scanning this QR code right here. Thank you once again for your time and engagement today. We look forward to you collaborating with us in the future. Thank you.